Hey, welcome back. This is Nasu with Fight for Kidneys. Today's topic we'll be discussing about depression and depression in kidney disease patient. This is a topic that I have been thinking about, and I felt compelled to come and talk about it because that's what I see, and that's what I see with my patients, and that's I just come to wonder how many patients are out there that don't even know they're depressed. So depression is that feeling of anxiety, feeling of hopelessness, feeling of overwhelmed, feeling of despair. And the thing with depression and ESRD is that the symptoms that most people report, a normal person report, that they're feeling are the same symptom a patient with ESRD report. They feel the same, not because they are depressed, but because their kidneys are failing, their kidneys are not functioning. They feel the same thing. So for instance, you may hear people say they can't sleep. That's one thing. They feel they're not able to sleep. Same thing with people who are depressed, or a normal person like me who is depressed may feel not able to sleep. The other thing is loss of weight and appetite, especially the new people who are their kidneys have failed. They are not even sure their kidneys have failed, and they go to the doctor because they feel like they're losing weight, they don't have appetite, and that's what they present with. And now come here, you're already an ESRD patient, and you experiencing that, but probably it's because you're depressed. The other one is low energy. So people, a normal person like me who is depressed, I feel I just want to sleep. I want to sit at the couch and just sleep the whole day. I don't want to talk to anybody. I don't want to look at the light. I want to just cover myself with the blanket. Here come an ESRD patient that feels the same because they are tired. They had dialysis, they feel I can't do it, they have that fatigue, but it's not because of dialysis, it's because they are depressed also. And a normal person like you and me, we have a threshold. We can hold stress. Our bodies are capable of holding a certain amount of stress. And now, but after some time, there's a breaking point where you cannot hold that stress anymore. And that's where normal persons, they start getting depressed because of the things that they are going through. They are not able to overcome them. Now add that this is ESRD patient. They have just gone to the hospital and they have been told that, let's say this is a normal person who happened to go to the hospital and they are told that, your kidneys are filled. That's like, you're just hit like, wow, and you're like, okay. And then they tell you need dialysis, and then, okay, it's still not sinking in. And you're going through this, you're like, okay, I have children to take care of. I cannot work right now. I have to change my schedule. I have to be, a machine has to take care of me, I have to use machine to live. I have to take these medications. I cannot eat this. I have catheters. I have things need put in my arms, or I have something put in my stomach. All those things happen, and they're happening so fast that people feel, oh, wow, that's stress. And that's where then it comes that the depression start kicking in, that they have all this stress that has been added in their body, in their life, about ESRD, about dialysis, about taking care of themselves. They're feeling hopeless. They're feeling they can't do anything for themselves. So that happens, and then most people will not even know now that they are depressed. And people will just keep thinking, it's common, it's normal, but they have all these symptoms. That's why I'm coming here, because I've seen patients, I talk to them, and as medical providers, as nurses, as doctors, as social workers. That's why they have added this much training, that we ask more questions, asking a question after a question, so that we can dig deeper, and not just stopping there, asking, looking at the ways that we can address them. How can we help our patients? Some patient might feel suicidal and they might not even say it, verbalize it. I have, people say, I don't feel like living anymore. When the patient tell you, I do not feel living anymore, that it's like they're giving up, and that's when we have to help them maneuver, see what they can do, to support them, so that to see that there are different things can be done in a different way. We can help them, if they are not sleeping, they can get up, prescribe some sleeping medications. And why are we talking about this, and why? Because the reason why I'm talking about this is because from what I see from the patient, and I see new patients come in that are not, they have not been dialysis for a long time. They come, yes, they're like, okay, I was here, I'm coming to do dialysis. The first few months, they might be okay. But then it hit them when they realize, oh, this is not a one-day thing. It's not a one-day fix. This is me. This is life. And you start seeing the patient who was coming happy, talking to everybody, and they sit at the lobby and they do not talk to anybody. And you start seeing them declining. So one thing with the depression and ESRD, if not addressed, if it's not taken care of, it can increase hospitalization. You see, these patients are going to hospital constantly, and when they go to hospital, sometimes because of the symptoms mimicking each other, a kidney failure, or the same symptoms, with just that your kidneys is not functioning, but they're also depressed. So sometimes they might not get treated for depression, and they get treated for ESRD, and the symptoms that they're treating the symptoms, not the root cause. And then you see these patients have a low quality of life. They're depressed. They might not even come to dialysis. They don't want to get up of bed. They don't want to do anything. So they need dialysis. They do not show up for dialysis, and then their quality of life continue to deteriorate, because if your kidney is not functioning and you're getting dialysis, really you don't have a quality of life. Your whole body start changing. And you also see that they have poor health outcome, because say for instance, somebody who feel they're helpless, they feel overwhelmed, and that's they're depressed and feeling hopeless. Sometimes no matter what you try to do, that they might not be able to take it in and say, okay, I need to do this, because they are depressed. The other thing that I need to highlight is that when the symptoms that people present with ESRD, and they present with depression. So for instance, if I'm a normal person who is depressed, I might feel pain. You have those pain that you don't even know where they're coming from. You go to the doctor and you're like, I have pain. And you're like, you cannot even point where the pain is coming from, but you feel that pain. So that's a sense of, you might be depressed. It's not physically pain, physical pain. It's mental pain, but you're really feeling it. And the worst thing with pain, nobody can say if you have pain or you don't have pain, unless you have a broken leg or a broken hand and you're trying to stretch and you can't stretch those bones. That physical, you are feeling it and you have there, but you can have emotional pain. You cannot tell where that pain is coming from, but you're feeling painful. You have this uncontrolled pain. You also have, like I said, difficulty sleeping. Whether you are a normal person who is depressed, you have difficulty sleeping. And then you are ESRD patient who is not even depressed, but you have difficulty sleeping, because of all these hormonal changes, anxiety. You are newly diagnosed with ESRD. you're already anxious. You're like, oh my goodness, what am I? What is next? You don't even know what to expect. You walk in, you're that person. If you see blood, you can faint. And here you come. You're told you have to have, blood has to come out of your body to a machine and be cleaned. Or then you have the tubes, and then you have another tube on your stomach, and you're like, oh God, you have to do this. If you have to do PD, and you're like, oh, I have to take care of myself. That's another anxiety inducing activity that you feel. Even a normal person, that induce some anxiety. And then a normal person who is depressed feel anxious. So you see that it's very hard sometimes to treat, but we need to talk about it, and know people need to speak about it. That's my thing. Like, we have to speak about it. The other thing is feeling powerless. Like I said, you go there, you can't take care of yourself. Now people have to take care of yourself. Your family members have to take care of yourself. Your friends have to take care of yourself. Have to take care of you, and you have to take care, family members, and all these people have to take care of you. And people in the clinic have to take care of you. And you feel hopeless, powerless, that people have controls. Somebody else is in control of your life, and you feel lack of control. That's another thing that can induce depression. But even in the normal depression out of ESRD, that the thing that causes is when people feel powerless. They have other stressors in their life. They could be financially. A normal person who is not ESRD, they are financially stressed and they are depressed because they feel, I cannot take care of my family. I don't have the finances to take care of my patient, my family. So they become depressed. Inability to start the social pressure. And this comes where, say for instance, you lost a job. This is a normal person who is not ESRD patient. They lost a job, and they were probably up high there in the socioeconomic status, and they are like, now they have lost that job, and they're like, oh God, now what are people gonna think about me? What are people gonna do? What are people, they become depressed. They don't even want to get out of the house. They used to golf. They can't even golf. Now this is the other patient. Now, who was a normal patient have become ESRD patient and used to go out with friends, go golfing, go to the restaurants, go travel, do all these things, and now they have their schedule is becoming strained, because some of them, if they have to go to an in-center clinic, they have to go for dialysis. If they're doing it at home, they still have a schedule to deal with, and feeling that they can't do the things that they were doing before, they become depressed, and that adds depression. Just even a normal person who is not depressed, a normal ESRD patient who is not depressed, but this that thing you feel out of control, and I feel now I cannot eat the same meals I used to eat. If I go with my friend, I can't go with my friends because I can't drink, I can't do this, I can't eat this, I can't eat this, and they feel they are not fit. That induces another depression right there. And feeling of hopeless, like I said, it's because somebody has to take care of you. But now let's talk about this. And this is where I am, and this is where I'm coming in, and this is why I'm talking about depression. That those little things you hear in your brain, in your emotions, and you wake up, you feel tired, and you feel you don't want to live again. Please speak to somebody. Let your friends, family members, your co-workers, if you work, let them know that, hey, I'm diagnosed with ESRD. I have to go to dialysis a couple of times. Tell them how you feel after dialysis. Tell them how you're feeling. And that way, these people you can be able to have support. People knowing that, okay, I can help you. I can come. People will offer to sit with you. If you're doing dialysis at home, they might say, I'll come and sit with you the time you're doing dialysis, and we just go down the memory lane of the things that you guys did. So talking about it, joining a support group, seeking medical attention, and really detailing everything that you're feeling and you're going through. Do not never say that's little, because that little thing that you might ignore, it might build up to something major that you feel you have out blown out depression, and that you're like, you feel like you can't take it anymore, you feel like you need to end your life. And that's why I'm saying, always talk about it. Talk about it with your doctor, talk to you about it with your nurse, talk about it with your social worker, talk to your friends, talk to your family members, talk to your children. And I feel, and this is what I have seen, most people don't want to talk to their patient, to their children about being in dialysis and what they go through. Let them talk to them. Let those people be there to give you support. Most of us and most people feel, if we have young child, you don't want to tell them because you don't want to stress them. But if we talk to them and letting them know, hey, mommy goes through dialysis, has this machine that has to be put on me, and they have to take blood out of me. You know, you have to explain to a simple thing and say, by the time I get home, I feel tired. Sometimes mommy has to take a break. Let those kids understand. Let them know, hey, I go to dialysis on this day, and we can do this. Do a schedule. Say, this is the day that we'll do this activity. This is the day mommy can take you out. This is the day mommy can do this with you. And those children will understand. They will understand what's going through with their mother, the father, or whoever is the person taking care of them. And that's why we have to speak. Don't get depressed, wondering, oh, I can do this for my kids. I can do this for my kids. They might seem real, but if we talk to them and they understand, they'll be there giving us support. And nobody is old that doesn't. Nobody is old enough to not need support. All of us need support at any age, and it might be that young person that might give us that strength to overcome. So thanks again for joining me. Thank you for watching this video. Please continue to subscribe, and thank you to those who have subscribed and those who have become regular viewers. And let people know, talk to your loved one, let somebody else know. And before I end this video, remember that the main cause of kidney failure, or the main risk factor for kidney failure, is high blood pressure and high blood sugar. So make sure you keep your blood pressure in control, your blood sugar in control, and ask your friend when you go, and your family friends and your co-workers, how is your blood pressure? How is your blood sugar? And that way people will open their mind and say, hey, I need to be checking. I need to keep an eye on those things, because if you control that, that might reduce your risk of getting into kidney failure. Thanks again, and I'm so delighted for you to be part of this journey with me as we discuss, we fight for kidneys, and encourage and empower those people who are going through kidney failure, for family members who have a loved one going through kidney failure. Till next time, thank you. Please subscribe and give a thumbs up. Thanks.